How is umbilical cord clamping performed on newborns? Have you ever wondered what happens right after a baby is born, especially when it comes to the umbilical cord? Let's break down the process of umbilical cord clamping and why it matters for newborn care. Umbilical cord clamping is the procedure of closing and cutting the cord that connects the newborn to the placenta. This step is essential in newborn care and usually occurs shortly after birth. Before clamping, healthcare providers often wait a little while. This is known as delayed cord clamping. It is generally recommended to wait at least 30 to 60 seconds after birth for healthy term and preterm babies. Some guidelines even suggest waiting 2 to 5 minutes if the baby is doing well and does not need immediate medical attention. Why wait? Delayed clamping allows more blood to flow from the placenta to the baby. This extra blood can help improve the baby's iron levels and blood volume, which is beneficial for their health in the early months. During this waiting period, the baby is typically dried off and stimulated to breathe. Skin-to-skin contact with the mother is encouraged to help keep the baby warm and comfortable. If the baby needs help breathing, this can sometimes be done while the cord is still attached, making the transition to independent breathing smoother. When it is time to clamp the cord, the healthcare provider places a clamp about 2 finger widths away from the baby's belly. A second clamp is placed a bit further away from the first one. The cord is then cut between these 2 clamps using sterile scissors or a new blade, making sure to cut away from the baby to avoid any injury. The small stump that remains attached to the baby is left to dry and heal naturally in the air. It is important not to apply any substances to the stump unless specifically advised by healthcare providers. After clamping and cutting, the cord stump is monitored closely for any signs of bleeding or infection, especially in the first few hours after birth. If any bleeding occurs, the clamp may need to be adjusted to ensure the stump stays secure. For millennial mothers, understanding this process can help in making informed decisions about birth plans. You might want to discuss options like delayed cord clamping with your healthcare provider. This approach supports the baby's natural transition and can make you feel more involved in your newborn's care. Overall, umbilical cord clamping is a key part of newborn care. It involves careful timing to optimize the baby's health, securely clamping and cutting the cord, and taking good care of the stump afterward to prevent any complications.